Okay, good morning. We'll call this Board of Health meeting to order at 8 o'clock. If everyone could, before I start, sorry, gotta read the, just need to read this little blurb. Pursuant to Governor Baker's March 12, 2020 order suspending certain provisions of the Open Meeting Law, General Law, Chapter 38, Section 20, and the Governor's Executive Order, imposing strict limitations on the number of people that may gather in one place, although a quorum of the member of the Dudley Board of Health will be physically present for this meeting. No in-person attendance of members of the public will be permitted. The meeting will be live broadcast on Dudley Cable Access. Members of the public who wish to appear before the board or committee must make an appointment to appear on the upcoming agenda by contacting Jennifer Canoyer, 508-949-8007, or watersewer@dudleyma.gov. Placement on the agenda is not guaranteed, however, and the persons requesting to appear before the board committee should not attend a meeting in person unless and until the appointment has been confirmed by the Board of Health. Persons with matters appearing on a meeting agenda may request that they attend via virtual means rather than via in-person attendance. Such requests should be directed to Jennifer Canoyer, 508-949-8007, or watersewer@dudleyma.gov, no more than 72 hours, not counting Saturdays, Sundays, or legal holidays in advance, so that appropriate arrangements can be made. However, persons or representative with matters appearing on the meeting notice agenda who wish to be physically present at the meeting must observe the following requirements. In accordance with existing requirements imposed by Governor, meeting rooms will be limited in terms to the total number of persons that may be physically present at the same time, including Board of Health members and staff. Satellite rooms will be available for overflow, and the meeting will be broadcast in real time in those satellite rooms. Persons who wish to participate in any particular matter on the meeting agenda will be asked to wait in a satellite room until that agenda item is reached, at which point attendees will be rotated between the main meeting room and the satellite rooms as appropriate. Social distancing must be maintained in both the main meeting room and the satellite rooms. Face masks or coverings will be required in accordance with Governor Baker's May 1st, 2020 COVID-19 Order number 31. Order requiring face coverings in public places where social distancing is not possible. A copy of that order can be found at https://www.mass.gov. May 1, 2020 Masks and Face Coverings download. Failure to comply with these requirements may lead to an attendee's removal from the meeting. Okay. Now we can rise for the Pledge of Allegiance.
Big breath. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay. All right. Number 2 we had on here was the Boy Scout yard sale proposal. I know the Boy Scouts were going to be reaching out to us with some new proposals and things, but apparently they have not gotten to us at this time. So we'll just
Table that till.
table that till we get something from them.
Okay.
Item number 3 is, it says vote, but we won't be voting. We're going to be discussing Dudley Chalton Regional School District reopening plan. And I know, Roberta, you want to recuse yourself at this time, since you are a school nurse in this. So we'll just have you step outside, and shouldn't be too long.
All right.
So, you did get a copy of the reopening plan.
I did.
You read through it, or browsed through it at least.
Browse through it, correct.
I did get a copy of it. I did have a few concerns. There are a few concerns that we have. And I did meet with Mr. LaMarche and Mr. Matthew yesterday.
Good.
To answer a few questions. Like, I had some questions about the HVAC systems, because some of the schools have older HVAC systems and what's being done. So what they informed me is that they're receiving evaluation by an outside company of the HVAC systems. We will get a copy of that to see if they're deficient or adequate, and what needs to be done, and so forth. That was one of our concerns.
Very fair.
Let's see. We talked about the busing.
Yeah.
Because they're doing what the school committee has voted on is a hybrid approach.
Right.
First 2 weeks would be remote, then 2 weeks in and alternating, and students would only be one in a seat alternating, opposite ends of the seat on the bus. We discussed what would happen if someone comes to school with symptoms. We also talked about a self-certification that parents need, perhaps something needs to be done so that everyday parents are self-certifying that their student, their child is healthy.
Correct.
Because gone are the days where you can, oh, you got a slight fever, we're gonna give you some Motrin or Tylenol and send you off.
Right.
That's not gonna happen.
Many businesses have adapted to that, including daycare, so
Right.
that would be a good model to follow. I think it's,
Right. So they're working on that. This was put in place through DESI guidelines. And we recently found out that the Board of Health, as far as we're being told, we cannot overrule DESI guidelines. We can not like what they're doing. We can explain and tell them our concerns. But basically, at this point, what we're being told is we can't do anything more than just give our recommendations and things like that.
okay.
So, did you have any specific questions, concerns, or anything?
I didn't. I mean, it was pretty, from what I went through, pretty clear, there, and we had discussed a couple of those
Right.
things that you just brought up, so I think that's, they have to move forward with something at this point, and we'll.
Right. We will be meeting with them
Tweak it.
again in 2 weeks, so if you think of anything, shoot it off and we'll ask a question or
Absolutely.
something of that nature.
Absolutely. Feedback is good from others out there, too.
Right, right. And I think it was good that we sat down with them and hashed, and made them aware that we have some concerns, so.
Absolutely.
And we'll go from there.
Okay, sounds
Okay.
great.
Just
Morning.
Morning.
recapping, good
Sorry.
morning. No, that's okay, recapping about the school system
Yep.
meeting yesterday, so. Do you want to have Rose come back in? She just recused herself since she's involved.
Will the buses have more than one run, like in the morning to bring students?
They're
Or
not quite sure yet.
they're not sure yet?
Yeah.
We'll have to go by the
Still working.
numbers. Okay.
Yeah.
Sorry, I didn't mean to slam the door.
That's okay, I told you it'd be quick.
I meant to catch it and it was already closed.
That's all right, you can show your aggression, that's fine.
Sorry.
Okay, so number 4. Renewal for the contract for the health agent for the month of September. Catch your breath.
I know, I was only right there.
I'm sorry.
I walked over the cord, that was a
That was a
big
lot.
step for me.
That was, 36
shape.
steps.
Oh,
Jesus. Ah.
so I will entertain a motion.
I make a motion to renew the contract for Purcell and Associates for the month of September.
I second that.
We have a motion and a second. Any other discussion? Seeing none, all in favor? Aye.
Aye.
Passes unanimously. Okay. Up next, health agent, any report, comments, anything of that nature?
We've started our cycle of inspections, recycle. We've got about 50% of the food service establishments done. Right now, we had a very successful inspection at our nail facility. I think our rules really paid off, the rules that you generated. I think they came up to a satisfactory plus, at least.
I think they did very well,
Yeah.
absolutely.
That's good
Very,
to hear.
told the ladies how, I think it's, they've done a great job, and they were very knowledgeable. They were able to give the protocols, specific protocols, what they're doing, correct times for the wet disinfectants to sit on surfaces. They are getting source capture.
They're ready to
system.
move on to the next level
Right,
of
they're
air
doing
handlers.
Good,
and
they're doing great. Very proud of them,
That's good.
for what they've done.
They've
That's
done a
good to
very,
hear.
very good job.
Yep,
Good.
ladies were very nice.
That's good to hear. That makes us very happy.
Ice cream parlor is open,
Yes,
alcohol-free.
yes. It's very good ice cream.
They're looking to make pies.
Oh, yes.
They're gonna make
No.
pies.
They're looking to make pies.
Wow.
Have you had the ice cream yet?
No,
Oh.
but I saw the other day that they did a little survey about pies, and I was like, oh. They
I-
said,
I
which
heard
one?
it
And I
was
was like,
a-
how about all? I mean, really?
Who doesn't like pie?
Pretty decadent.
That's what I heard. I have to go check it out.
The ice cream is very good.
It's very good. And
Very
it's so
good.
nice to have a local place
Yes.
to go to.
That's awesome.
Treat the kiddos.
It was very good. You have to try it. You know, when something new opens, you have to try it.
Absolutely.
More than once, too. you know.
Absolutely. I was being-
Well, there's what, 50 flavors? Sorry.
There you go.
50 trips. Come on, guys.
I can tell you a few that are good.
All of the ice cream is made on site.
Yeah.
Oh,
They don't buy it. They churn all the ice cream at night.
oh my
Whatever they-
gosh.
And they have doggy ice cream.
Oh, I didn't know that.
Yes, they do. They have
Aw.
doggy ice cream, so I take one home every time. It's a nice little treat. It is.
Um,
All right.
Everything else is pretty well under control. There's no complaints about, there's a couple of minor complaints about one or two facilities, but we go in and just keep redirect, and retrain. They come around. Generally, we're in pretty good shape.
I'm going to I'm not going to send you, I'm going to ask you to go to a location in Dudley where we received a complaint of no masks again.
You want a list of the complaints?
No, I just got another
Oh,
one.
you got another one?
Yeah.
Yes, so we'd like you to take a look at it.
All right. I got a couple of things I've got to ask you about.
Okay, so, okay. Moving on, health nurse. What would you like to tell us? Remember, we're on TV.
Oh, yes, I know that, silly girl. Nothing really right now. We're holding steady at one. Really, the triple E threat is there, but nothing really here in our town. No confirmed cases of humans, but confirmed cases of mosquitoes that have it, but nothing really. They had some new changes on the sports guidance that came out. They just updated that, the 17th, a couple days ago, so I gotta take a peek at that, but nothing really that's, other than the travel ban, the travel order. Nothing that's really standing out that I can think of that's been a huge change other than those things.
So the sports have been going on now.
Some of the camps have still been going on, but they made some changes. There's like certain levels, like, red, moderate, and high risk, and medium risk, and low risk, and depending on what kind of sport it is. And they're saying now that you can play certain moderate or high risk sports as long as you bring it down a level. So I have to read a little bit more about it, but when I glanced at it quickly this morning, it said something about so if it's a high contact sport, you can maybe play it, but no contact. You could do drills. So like basketball, you could just do your own thing, but you can't play in a team because it's too much contact. So it almost seems like, why even bother? But I don't know. So I gotta look at that
Kids
a little
need
bit more and
something
see what it means.
Forward to what to do.
It appears as though the actual competition sports, though, for the fall season,
Yeah.
maybe we won't see them as we know it. Obviously, football and
Right.
basketball, unless something dramatic happens in between now and then.
Yeah, I don't think so. Right.
The likelihood is going to be drills only and no spectators.
Right.
Yeah.
We're talking about to renew some of the sports. They're talking about fall baseball now. At least baseball is supposed to be a non-contact sport. But
That's it?
Yeah.
Okay,
I'm good.
Thank you.
okay, thank you.
Welcome.
Any board member comments? Do you have anything?
I don't. Pretty
Okay.
much brought up anything that I had questions on.
Okay. I have a couple comments, just want to make quickly. Like Roberta said, we are at one, so that's showing that everyone in Dudley's majority are doing what they should be doing. Wearing the masks, taking the precautions, washing your hands, social distancing, and we appreciate that because that makes us a stronger community and having better numbers, and that's what our goal is. So we thank everyone for that. I want to thank Nichols College. They've had us up there like on a weekly basis to walk through, see what they've been doing. Yesterday, we went and visited their testing center for their students. I was
Yeah,
just,
it was-
it's just, everything was top notch, and we appreciate that because they know that they're bringing students, outside students, into our small town, and they're doing everything they can to try to stop the spread, which is, we appreciate that. They have just been amazing to work with, and once they open, we are gonna hit them up for lunch one day. We're
Yes.
gonna go enjoy a nice lunch up there. Yeah, I mean, they've just been, so I want to thank them. I want to thank the Dudley Chalton Regional School District for meeting with us yesterday, listening to us, going forward, meeting with us, trying to keep us up to date, and we'll be hopefully in the future doing a walkthrough of their schools as well. And, you know, I appreciate everyone working with us so closely, keeping us informed so that we can help keep the community informed. And I
The
think,
joint, the Board of Health from Charlton and the.
Yes.
and the agent.
Jim Philbrook has been great. He's been in on everything with us. We thank them. Charlton Board of Health, just, we're a dual community with the school system, so we have to work together. So it's been amazing, and I thank everybody for their cooperation during this.
It's a lot of good minds
It
getting
is,
together.
it is, and sometimes it's good to bounce stuff off because somebody thinks of something that you haven't thought of or they haven't thought of, and it raises more questions, more concerns, more thoughts. So I do appreciate that. And Roberta did mention EEE. So let's just put it out there that, as we all know, mosquito season is coming upon us. Take your precautions. That's all we want you to do at this time. You know, if you're out in the evening, wear long sleeves if you can. Make sure that you're using a bug spray. Just take the precautions to protect yourself. You know, we've all been quarantined and kept at home for so long. We want everybody to be able to be outside and enjoy things, but just be responsible and protect yourself. That's all that we ask at this time from you. And we do have stuff on the website regarding COVID, EEE, everything. So you have any questions or concerns, go to the website, look up something. If you have can't find something, send an email to boh@dudleyma.gov, and we're more than happy to send you back something, get you to a link, get your question answered, and so that's everything that I can,
Same.
you know, so thank you to everyone. If nothing else, I'll entertain a motion.
Make a motion to adjourn.
My second.
I have a motion and a second. Any other discussion?
No.
Seeing none, all in favor?
Aye.
Aye. Meeting adjourned at 8:20 a.m. Thank you.